What does a follow-up DEXA scan show about osteoporosis? Imagine getting a checkup for your bones to see how they are doing over time. That's exactly what a follow-up DEXA scan helps us understand. It's a special X-ray that measures how much mineral is in your bones, usually at your spine and hips. This measurement is called bone mineral density. When you have a follow-up scan, it compares your current bone mineral density to your previous scan. This comparison shows if your bones are getting stronger, staying the same, or losing density. A key thing a follow-up DEXA scan reveals is whether your bone mineral density has changed. Instead of just looking at the T-score, which is a standard way to classify bone health, the scan gives a precise number. This helps your doctor see if your bones are becoming weaker or if your treatment is working. If the bone mineral density has increased or stayed stable, it suggests your bones are getting stronger or at least not worsening. If it has decreased, it might mean your osteoporosis is progressing. Since bone mineral density is closely linked to fracture risk, these changes help doctors estimate how likely you are to break a bone. A decrease in density could mean a higher risk, while an increase or stability suggests a lower risk. This information is very useful for making decisions about your treatment plan. If you are on medication for osteoporosis, a follow-up DEXA scan can show if the treatment is effective. Stable or increased bone density indicates the therapy is working well. But if the scan shows a significant drop, your doctor might need to review your medication, check if you are taking it correctly, or look for other reasons for bone loss. Doctors usually recommend follow-up scans every 2 years, but this can vary based on your age, sex, risk factors, and how you respond to treatment. Sometimes, more frequent scans are needed if your risk is higher or if your treatment changes. To get the most accurate results, it is best to have the follow-up scan done on the same machine or one that is properly calibrated to match your previous scan. Differences in equipment can affect the measurements and make comparisons less reliable. It's important to remember that BMD measurements can vary slightly between tests. Some experts believe that doing scans, too, often might not always add much value in predicting fractures or guiding treatment. So, your healthcare provider will interpret your results in the context of your overall health, risk factors, and medical history. In summary, a follow-up DEXA scan shows whether your osteoporosis is getting better, worse, or staying the same by tracking changes in bone mineral density. This helps your doctor decide if you should continue your current treatment, make adjustments, or explore other options. It's a vital tool in managing osteoporosis over time, but it works best when combined with your overall health assessment and risk evaluation. Always consult your healthcare professional for personalized advice and to understand what your results mean for your specific situation.